Good morning. A second healthcare worker at Texas Health Presbyterian Hospital has preliminarily tested positive for Ebola. These tests will be double confirmed by the CDC in the next few minutes. Like Nina Pham, this is a heroic person. I'm sorry, I said like Nina Pham, this is a heroic person, a person who dedicated her life and is dedicating her life to helping others and is a servant leader. This is a person with their life before them and a person who is dealing with this diagnosis with the grit and grace and determination that Nina has dealt with the diagnosis. And like Nina, the protocol to find the virus worked well in that within 90 minutes of her temperature, of taking her temperature, she was in isolation in the hospital. And we hope that and pray that, like Nina, she will get on a good track. As you know, Nina has moved from stable to good, and the doctor may have some information on her health when he speaks this morning. So the fight against Ebola in Dallas is a two-front fight now. We have 48 disease contacts that we focused on in the community that were contacts with Eric Duncan. The good news about those 48 people is they are asymptomatic and have no fever, and we are at the tail end of their monitoring period. Sunday will mark the end of that monitoring period, and the chance of those people becoming symptomatic at this point or getting the Ebola virus is extremely remote. However, at the hospital, we have a situation involving 77 people, 2 of which have tested positive for Ebola. We are preparing contingencies for more, and that is a very real possibility. You can imagine the anxiety of the families of these 77 people. You can imagine the gut shot that this is to the family that is Presbyterian, a hospital that has done a great job of taking care of this community for many, many years. I hope this community will rally around the human beings that are suffering and worrying now, even as they go about their calling of serving others. With me today is Dr. Varga, the Executive Vice President of Texas Health Presbyterian, who will speak next. Mayor Mike Rawlings will speak after Dr. Varga, and we'll take some very limited questions after that time. We're giving you the very limited information that we have at present. We are continuing to get an information, and we'll be updating you throughout the day in a variety of ways. And we have some very important work that I need to get to the mayor and I need to get to at the conclusion of this. So, Dr. Varga.
Excuse me. Thank you, Judge Jenkins. Good morning. My name is Dr. Daniel Varga. I'm the Chief Clinical Officer for Texas Health Resources. And I want to thank the mayor, the judge, the CDC, state health officials, and the Dallas County Health Department for their continued partnership as we manage this unprecedented crisis. As others have said this morning, today's development, while concerning and unfortunate, is continued evidence that our monitoring program is working. Currently, as Judge Jenkins says, we continue to monitor 75 healthcare workers in conjunction with the state. And while I cannot discuss patient specifics, I can tell you this new patient was involved in the care of Mr. Duncan, the original patient whose passing we still mourn. Our interest at this time, first and foremost, is making certain that both our current patients receive the care they need. That will remain our focus. The health and safety of our patients and employees remains our highest priority, and we will continue to coordinate with officials at all levels to meet the challenge that Ebola presents to our hospital, our community, and our country. A lot is being said about what may or may not have occurred to cause some of our colleagues to contract this disease, but it's clear there was an exposure somewhere, sometime in their treatment of Mr. Duncan. Let's be clear, we're a hospital that serves this community incredibly well, and we have for nearly a half a century. We're a hospital that may have done some things different with the benefit of what we know today, but makes no mistake, no one wants to get this right more than our hospital, the first to diagnose and treat this insidious disease that's now attacked two of our own. After several weeks of great emotion and great effort, our team's spirit is tried and tested, and the support of so many is really helping everyone to rise to continue to meet this challenge. Thank you.
Well, good morning. Another long evening and morning for many, many people. We rallied together and we decided that we needed to move quickly like we did Sunday morning to make sure two things happened. One, that effective cleaning was done as soon as possible, and two, neighbors and the citizens were communicated. It is no odd thing that we decided to do this at 7 o'clock in the morning, so when folks are getting up, they know what the facts are. It is a concerted effort, not only with the county and the state and the city, but individuals out there. This morning, Chief Brown, Chief Bright, our city manager, were all working in coordination to accomplish our goals for this morning. Dallas Fire and Rescue went to the 6,000 block of Village Bend Drive, where they began phase 1 of decontamination of the common areas and the areas outside the apartment. Our patient lived alone and with no pets. State of Texas has hired Protect Environmental for phase 2, that inside the apartment and the cleaning of the car and the movement of the same, removing the same. That hopefully will be done early this afternoon. I personally was at the apartment complex this morning and talked to citizens as they were waking up and moving about, which leads us to the second part of our strategy, communication. We worked closely with the apartment managers in creating a strategy that I think is working. Each apartment in their complex the door was knocked on, and we talked to as many people that came to the door as possible. Same time, the apartment complex will be handing out flyers and information to apartment complexes nearby. So we cast the net a little wider. And then we had reverse 911 calls that went out at 6:15 this morning. Meanwhile, we continued to not only monitor the 48 individuals that came in contact with Mr. Duncan, but we take care of Louise and her family, who are still in isolation. They are asymptomatic, and they are doing well. And as you know, we moved Nina's pet yesterday, and are making sure that that pet is well and taken care of at the same time. I think there are two things that I hearken back to this. The only way that we are going to beat this is person by person, moment by moment, detail by detail. We have those protocols in place, the city and county, working closely with the CDC and the hospital. The second is we want to minimize rumors and maximize facts. We want to deal with facts, not fear. And I continue to believe that while Dallas is anxious about this, and with this news this morning, the anxiety level goes up a level, we are not fearful. And I'm pleased and proud of the citizens that I talk to day in and day out, knowing that there is hope if we take care and do what is right in these details. It may get worse before it gets better, but it will get better.